Good morning, everyone. Today, from question number 126. Medical term for pain associated with menstruation is called as option A dysuria, option B dysphagia, option C dystocia, and option D dysmenorrhea. Medical term for pain associated with menstruation is known as dysmenorrhea. Option D. Question number 127. Regularly timed episodes of bleeding that are excessive in amount are called option A metorrhagia, option B menorrhagia, option C polymenorrhagia, and option D menometorrhagia. यदि रेगुलर पिरियडमा एक्सेसिभ ब्लिडिङ भएको छ भने त्यो केसलाई मेनोरेजिया भन्छ। इरेगुलर पिरियडमा एक्सेसिभ ब्लिडिङ भएको छ भने त्यो केसलाई मेटोरेजिया भन्छ। यो दुईटा टर्म कन्सेप्टमा राख्नु होला। रेगुलर टाइममा ब्लिडिङ एक्सेस भएको छ भने मेनोरेजिया र इरेगुलर टाइममा भएको छ भने मेटोरेजिया। यहाँ के भनेको छ रेगुलर टाइम भने आन्सर मेनोरेजिया अप्सन बी। पोलिमेनोरिया भनेको के हुन्छ? यसमा धेरै एक्सेस मात्रामा ब्लिडिङ हुन्छ, टाइम रेगुलर नै हुन्छ, तर के हुन्छ 28 डेजमा आउनुपर्ने पर मन्थ, तर के हुन्छ यसमा 21 भन्दा पहिले आएको छ हैन। फिक्स रेट हुन्छ, रेगुलर नै हुन्छ, तर 21 डेज भन्दा पहिल्यै मेन्स्ट्रुएसनमा ब्लिडिङ एक्सेस भएको छ भने त्यो केसलाई पोलिमेनोरिया भन्छ। मेनोमेटोरेजिया भनेको चाहिँ ब्लिडिङ ड्युरिङ एन्ड बिट्विन मेन्स्ट्रुएसन पिरियड। क्वेसन नम्बर 128. Irregular cyclic bleeding from the uterus is termed option A menorrhagia, option B epimenorrhea, option C metorrhagia, and option D dysmenorrhea. Dysmenorrhea means painful menstruation and irregular means metorrhagia. Option C is right answer. मेनोरिया केमा हुन्छ? रेगुलर साइकलमा हुन्छ। यसको भयो मेटोरेजिया। क्वेसन नम्बर 129. Bleeding through vagina between two means is called option A metorrhagia, option B menorrhagia, option C menopause, and option D dysmenorrhea. Bleeding through vaginal between two menses is metorrhagia. Option A is right answer. Menorrhagia भनेको रेगुलर साइकलमा। Option A is right answer. Question number 130. The condition in which the bleeding is so irregular and excessive that the menses cannot be identified is known as option A menorrhagia, option B metorrhagia, option C polymenorrhea, and option D menometorrhagia. यसमा के हुन्छ? मेनोमेटोरेजिया अप्सन डी। Question 131. Commonest cause of a primary amenorrhea is option A genital tuberculosis, option B Mullerian anomalies, option C ovarian dysgenesis, and option D hypothyroidism. Common cause of primary amenorrhea is Mullerian anomalies. Option B. Question number 132. A wide range of recurrent symptoms that occur during the luteal phase or last half of the menstruation cycle and resolves with the onset of menstruation is known as option A amenorrhea, option B dysfunctional uterine bleeding, option C dysmenorrhea, and option D premenstruation syndrome. Option D is right answer. Premenstruation syndrome. Premenstruation syndrome is a disorder that is characterized by symptoms such as a markedly depressed mood, anxiety, affective lability, and decreased interest in activities. These symptoms occur during last week of the luteal phase, half of the menstruation cycle, and resolve with the onset of menstruation. Question number 133. An inflammatory state of the upper female genital tract and nearby structure is called option A hepatitis, option B PID, option C gonorrhea, and option D syphilis. An inflammatory state of the upper female genital tract and nearby structure is called PID, pelvic inflammatory disease. Option B is right answer. Question number 134. In following, which is the main cause of PID, pelvic inflammatory disease? Option A, abruptive placenta. Option B, placenta previa. Option C, ectopic pregnancy. And option D, PPH. The right answer is option D, PPH. Cause of PID are an ascending infection from the vagina and the cervix to the upper portions of the female reproductive tract. Postpartum hemorrhage may increase the risk of a PID. Chlamydia trachomatis and Neisseria gonorrhea are the most frequent cause of PID. Question number 135. The most common cause of PID is option A, Mycobacterium tuberculosis, option B, Streptococcus, option C, Staphylococcus, and option D, gonorrhea. The most common cause of a PID is gonorrhea. Option D is right answer. Question number 136. A generic term that means inflammations and infections of the vagina is option A, endometriosis, option B, candidiasis, option C, vaginitis, and option D, pruritus. A generic term that means inflammation and infections of the vagina is known as vaginitis. Option C is right answer. Question number 137. The causative agent for bacterial vaginosis is option A, Hoff simplex, option B, Candida albicans, option C, Chlamydia trachomatis, and option D, Gardnerella vaginalis. Gardnerella vaginalis. Option D is right answer. Question number 138. The test used for the diagnosis of trichomoniasis is option A, wet mouth of vaginal fluid, option B, ELISA test of serum, option C, specific serologic test, option D, ova and parasite fecal smear. Option A is right answer. Wet mouth of vaginal fluid. यो भनेको हुन्छ vaginal smear, जसमा के हुन्छ भेजाइनाबाट एपिथेलियल सेल चाहिँ स्याम्पलको लागि लिन्छ र माइक्रोस्कोपिक एक्जामिनेसन गर्छ र आइडेन्टिफाई गर्छ कि ट्राइकोमोनासिस छ कि छैन. Question number 139. Name the test where secretions is mixed with a drop of 10% potassium hydroxide on a slide, producing a characteristic state feces odor. Option A, non-treponemal test. Option B, treponemal test. Option C, rapid plasma resin. Option D, a fee test. यो टेस्टलाई हफी टेस्ट भन्छ. अप्सन डी इज राइट आन्सर. जसमा के हुन्छ त 10% चाहिँ पोटासियम हाइड्रोक्साइड चाहिँ एड गर्छ यसमा फर द युज अफ फिसी आउडर. पोजिटिभ टेस्ट इज सजेस्टिभ अफ ब्याक्टेरियल भ्याजिनाइटिस. Question number 140. The main cause of genital warts. Option A, human papilloma virus. Option B, pelvic inflammatory disease. Option C, Neisseria gonorrhea, and option D, Hoff simplex virus. Human papilloma virus. Option A is right answer. Question number 141. The transmissions of the infection from mother to the fetus through the placenta is termed as option A, latrogenic, option B, teratogenic, option C, nosocomial, and option D, fomites. Teratogenic. Option B is right answer. Any agent like drug, pathogens, है ना, rubella toxins which causing abnormal development of the embryo called teratogenic. Question number 142. Ability of the drug to cause fetal abnormalities when administered during pregnancy is known as. Option A, therapeutic effect. Option B, idiosyncratic reaction. Option C, toxic effect. And option D, teratogenic effect. Option D, teratogenic effect. Question number 143. If complicating pregnancy, which of the following disease may result in a serious teratogenic defect in the offspring? Option A, rubella. Option B, rubella. Option B, variola. Option D, varicella. Rubella. Option A. Question number 144. When are the chances of acute endometritis developing in a woman? Option A, after menopause. Option B, after menarche. Option C, after abortions or childbirth. Option D, in childhood. Endometritis means inflammation of the lining of the uterus. Is the most common during childbearing age. And the woman is at the highest risk for endometritis during the immediate postpartum period. केमा हुनसक्छ आफ्टर मेन्सुरेसन अथवा चाइल्ड बर्थ होइन द्याट मिन्स एबोर्सन भएपछि जुन पोस्टपार्टम पिरियड स्टार्ट हुन्छ त्यसमा र नर्मल डेलिभरी भएपछि पोस्टपार्टम स्टार्ट हुन्छ त्यसमा चाहिँ बढी चान्सेस हुन्छ चाहिँ इन्फेक्सन चाहिँ बढ्ने होइन त्यही भएर यसको एन्सर अप्सन सी हुन्छ क्वेसन नम्बर 145 वाट इज द कज अफ इन्फ्लामेसन अफ बार्थोलिन ग्ल्यान्ड अप्सन ए स्टेप्टोकोकस अप्सन बी गोनोकोकस अप्सन सी स्यूडोमोनास and option D, Staphylococcus. Common causative agent which infect the Bartholin gland are E. coli or STD such as chlamydia or gonorrhea. Option B is right answer. Question number 146 in other video. Thank you so much.